Welcome back to Showcase Pittsburgh on KDKA-TV. I'm your host, John Klein. Today, 7 excellent tri-state businesses. And right now, let's welcome Dr. Babak Firouzi from the Center for Aesthetic Dentistry. Welcome to Showcase Pittsburgh, Doctor.
Thank you, John.
Right out of the gate, I was on your website, and I was shocked that 2020, the news show, had run a special on how some dentist offices aren't as clean as what we thought they were. And you have addressed that. What have you done?
Well, we've done a few things kind of above and beyond what's mandated by the state or cities. What we do is, the problem is sometimes they're saying that the water lines that go to the drills and the water sprays can accumulate bacteria. So what I have done is we have a 2-bottle water system, so that one of them is water that we use on our patients in the drills and the water spray. The other bottle has a disinfectant. So this system allows us to get the water out of the lines at the end of the day or end of the week and run this disinfectant in the lines to kill all these bacteria and viruses, so that the patients know that the water that's going in their mouth is clean. The other thing we've done is there is also a problem that they talked about on TV about backwash from the suctions that we put in patients' mouth. In other words, when you put the suction in your mouth, you can get some of this contaminants from the patient before you spill back in your mouth. We've installed a valve on these suctions so that it makes it impossible for that to happen. You cannot get any contaminant from the patient before you going back in your mouth. And the last thing we've done is we've hired a university to do all of our monitoring of our sterilization equipment. I just feel safer knowing that a university is monitoring all of our equipment.
Are you one of the lead dentists in the area to address some of these issues?
I would think so. I mean, a lot of dentists, there are certain things mandated, which means you have to monitor your equipment with sterilization, companies. Like I said, I kind of searched and found this University of Indiana, that I think they do a very, very thorough job. And I just feel better knowing universities doing that for me.
Tell us a little bit about your background. You've been in Pittsburgh for about 25 years, and you went to the University of Pittsburgh. Tell us about your background.
Yes, I went to University of Pittsburgh, undergraduate, and then dental school. And then after graduating, I did a 2-year residency at a hospital in Connecticut that was affiliated with Yale University. And then after that, I moved back to Pittsburgh, and I purchased my practice. I've gone to, I do a lot of training at a place called LVI, which is Las Vegas Institute for Advanced Dental Studies. And we do a lot of cosmetic training there, and we do a lot of neuromuscular training there.
On your website, I saw that people who have headaches can sometimes trace the result of these headaches to dental problems.
Yes, absolutely.
How can you get around that?
Well, now we know, and science is telling us, that a lot of these tension headaches, which is the most common type of headache, could be caused by a bad bite, we call it. In other words, the teeth don't mesh together in a balanced position. Now, the first thing I say is, if you get a few headaches, just take some over-the-counter pain pills, no problem. If you get a lot, obviously consult with your physician too. But if the physician says there is no problems like a tumor or anything like that, then it could be from your bite. And what I do is, first we relax all the muscles of the neck and the face with a muscle relaxing machine that they use at physical therapy. Once these muscles relax, we can see where the muscles want to hold the jaw in their most relaxed position. And we take a mold of the teeth and the bite, and we make an orthotic, which is basically a plastic appliance that the patient wears over their teeth. And that corrects their bite. Every time they open close, they go into this completely relaxed muscle position. And the nice thing with this interim treatment is that we know now if the headaches are going away or not. And if the headaches start to go away, we know their bite was causing it. And then after that, the patient has a few options that are more permanent to correct their bite into this better position.
So a lot of people who have headaches might not realize the headache's coming from their teeth.
Exactly, exactly.
Let's talk about smiles and cosmetic dentistry. We were talking before we got started about how somebody's smile and their teeth can sell them, and if a sales rep has a beautiful smile, it just boosts confidence, or if somebody's out looking for the right person. Tell us about some of the things that you've done.
Exactly. Like you said, there's a bunch of reasons somebody may want a better smile. Maybe they just want to look more attractive. Maybe they just don't like their teeth when they look in a mirror. But I think the most important one now, especially with the economy and the job market being bad, some people understand that having a nice smile gives them more credibility to get that position, to have an edge over another person. So whatever reason they have, now with the new technology and the material out there, we can actually give them that beautiful smile. And they're not going to look fake or like caps or false teeth, because I think a lot of people are worried about that their teeth are going to look like chiclets. But now with the new stuff that's out there, we can actually make them look so real that no one can tell if they had any kind of work done in the front of their mouth.
My daughter is 19, wants to get her teeth bleached, and technology has really changed recently about teeth bleaching, and you are at the forefront of that also.
Yes. You know, I've been doing bleaching for a long, long time. And like a lot of patients and dentists, I was getting frustrated because I wasn't getting the results that I wanted to get. And patients weren't getting the whitening, the whiteness that they wanted. So I started searching, and I found this new system called Core Deep Bleaching that absolutely gives people that amazing white smile with hardly any sensitivity. And basically how it works is we take really, really accurate impressions of their teeth and gums, and then the technician at the lab makes me a very super accurate trace. And once they put the bleach in those, that tray is so accurately made that it seals the bleach on the teeth so it won't go on their gums and it won't ooze out into their mouth, so that it actually works on the teeth.
And when you say bleach, you don't mean bleach like we buy in the grocery store.
Right. No, it's actually hydrogen peroxide.
Now, we talked about this before we got started too. Isn't it dangerous putting a chemical into your teeth?
Well, a lot of people think that, but it's not, because some people think that chemical is removing something off their tooth and is doing some damage to the pulp or the nerve of the tooth, but it doesn't. All we're doing is basically changing the shade of the dentin, which is a layer of tooth underneath the enamel. All we're doing is we oxidize it. In other words, we just make that whiter so that the tooth appears whiter.
How long does it last?
Forever.
Forever. So
Forever.
You don't have to come back in a year.
No. All you have to do is what we call maintaining that, which means you just get some of that hydrogen peroxide, and once a month you put it back in the tray and put it back on your teeth. You can actually drink wine, coffee. Hopefully you don't smoke, but if you smoke, you can even smoke.
Let's, before we wrap up, the laser scanner is something that I found interesting on your website too. What is that?
Yeah, that's like the coolest technology out there right now. I mean, it's never going to replace x-rays. We still need x-rays to confirm cavities, but this laser scanner allows us to find these real tiny cavities before they become really big. Everybody's gone to the dentist, and 6 months earlier they went and there was no decay. Now all of a sudden, 6 months later, the dentist says you have decay. The problem was the decay was always there. It's just that he couldn't see it and he couldn't confirm with x-ray. What this laser does is it shines this real harmless laser beam into the tooth, and if there is decay, it reflects it back to the tip and it registers a number on this laser scanner. And we can tell by that number how deep the decay is. We can actually, if the decay is not deep and the number is not high, we can actually fix a lot of these cavities without even numbing the patient.
And this is something that is pretty widespread in dentistry right now, or it's really new and you have it?
It's fairly new. I'm not sure how many other dentists have it. I'm sure there's a few dentists that have it, but it's not widespread.
Thank you, Dr. Firouzi. If you would like to contact the Center for Aesthetic Dentistry, call them at 1-800-368-2809 or log on to PittsburghAestheticsmiles.com. If you would like to advertise your products or services here on Showcase Pittsburgh, you can call us at 412-575-2400 or email us at showcase@kdka.com. That does it for today's show. I'd like to thank Dr. Firouzi and the Center for Aesthetic Dentistry. Thanks for joining us today. I'm John Klein, and we'll see you on the next Showcase Pittsburgh.